Beautiful people, welcome back to the channel. I hope everyone is doing well. I hope you're having a fantastic day so far. In today's video, I am going to primarily be focusing on remote healthcare jobs. I'm going to be talking about them from the perspective of the company specifically, so that in the future you can always explore these companies for fully remote opportunities as well. All right, with that being said, before we go into the video, I want to encourage you guys to always have your notification bell turned on. It's really important. I can't emphasize it enough, especially if you are actively looking, because these jobs, they close very quickly. They are flying off the shelf, guys. I encourage you to have your notification bell turned on, because then you're notified real time by YouTube whenever I post new job leads, because my goal is for you guys to be able to hear these real time and apply as quickly as possible. With that being said, right, so we're going to dive right into the opportunities. So the first company we're going to be talking about is Premise Health. And Premise Health, they have many opportunities that they have open at the moment. So there are different roles that are open, but I'm going to be focusing on one specifically in this video. But let's look at Premise Health for a second. Look at their description. It says Premise Health remote roles offer flexibility and convenience for those who prefer to work from home or any space of their choosing. Our remote team members are an integral part of our community, and we support them by facilitating seamless digital connection with your team. We care deeply about our remote team members' well-being and are dedicated to supporting a healthy work-life balance, in addition to competitive pay, comprehensive benefits, paid holidays, vacation time, etc. So this is a company that specifically, right, talks about what they do. I always like whenever I see that, because it shows already that this company has a focus on remote jobs. So they already have a preference for it, and in addition to that, they also have a desire to do it. So it's not just, oh, because you asked for it, you got it. But this is already an established system structure that's already put in place. They have that. So they have a population health coordinator role. This position, your focus is going to be, obviously this is in healthcare, right? So you are going to be helping to ensure that any type of communications with members, making sure that work queues are empty, escalating as needed, reviewing of different documents to provide outreach, reviewing of electronic medical records, maybe in addition to that also leveraging different departments within the organization, especially those that are focusing on wellness programs, making sure that those programs are providing support to the members, and in addition to that, that the quality is there for these programs. Also using data to determine quality. All of that is what this role entails. It talks about member privacy, confidential member information as well. So PHI is very essential for this role. HIPAA is essential for this role. Having knowledge of Excel is essential for this role, and also being a good communicator, whether it's in writing or verbally, is also essential. For this position, they are requiring you to have high school diploma or GED, and then 2 years experience working in a healthcare environment, and 2 years working in an outreach setting, or any type of providing assistance for social needs. For example, providing community resources to people to help them navigate their health better, etc. All of that is important. They also talk about having prior knowledge with electronic medical record. That makes sense, right? Because that is part of one of the key essential functions they called out on the list here that says essential functions. So they have a preferred experience section where they talk about having an associate's degree or equivalent work experience. They also talk about completion of a medical assistant training, if that's something that you have. But these are preferred qualifications. They are not expected. So if you have them, it's definitely a plus. But even if you don't have them, I still encourage you to go ahead and submit your application, especially for this where they're talking about equivalent work experience. If you have more than 2 years working in a healthcare setting, that is very advantageous. So you want to make sure you call that out in in your resume. For this position, this is a full-time position, so as you can see here, it's also fully remote, and you're going to be working Monday through Friday, and it's 8 a.m. to 4:30 p.m. So a lot of times when I don't see specific time zones that is specified, so usually that is Eastern time zone, so it's 8 a.m. to 4:30 p.m. Eastern. So that is the hours. And for this particular role, based on my research, the salary range is between $45,000 and $60,000 per year. So definitely check it out. So that's the first opportunity. The second one we're going to be talking about, again, from the perspective of the organization or the company, it's CareCentric. So CareCentric is one that, for those that are familiar with my channel, is one that I have actually done a number of videos on in the past. They are a healthcare facility. They focus on providing support and care, social as well as medical, to different population. They cater to Medicaid, Medicare population, as well as commercial population. So they are really all over. So they just provide different medical services to ensure that people continue to stay and live healthy lives. They have a variety of opportunities all the time. Right now, they have this position titled Social Services Coordinator position that is open. This role is titled Social Services Coordinator, and I'm sure you're thinking already, basically this individual is going to be providing assistance around social services, and you will be correct. So this particular position, the salary range is between $45,000 and $75,000 per year. Obviously, where you fall in this bracket is highly dependent on the experience you bring to the table, your educational background. In addition to that, depending on where you reside, this is a fully remote opportunity, so standard of living comes right into play. Where you live is going to determine if they give you more money or if they give you less. All of that are factors that are considered for salary placement. With this position, it says already, as a social service coordinator, you will work with the nurse coach team, helping patients find resources and items they need upon discharge. So you're going to be helping families, patients get on that journey of staying healthy, especially if they've been in the hospital. So providing resources to them, helping them navigate any community challenges they may be having, whether it's getting to their appointments or in some cases transportation to appointments and so forth, or just having someone to talk to, helping them just coordinate their care all together. That's what this position is. You're going to be obtaining different information, providing different community resources. For example, if someone is diabetic, this individual can say, okay, I see you're still struggling even though you meet with your doctors frequently. Maybe let's try something different. There's a service called Diabetes Peer-to-Peer Education, which is really just different peers coming together, people that are diabetic or people that are afraid of being diabetic, coming together and kind of sharing their success stories. What are things they do that are successful, that makes them successful? What are some challenges that they've been facing? That's really what this position would do. Just to give an example, in terms of qualifications, they have here, you have a bachelor's degree or higher degree in social work or related field. They're talking about having a deep knowledge of community and resources, someone who is also very good in planning and have a significant knowledge of medical terms. You must possess 5+ years experience in community resource management or health plan benefit management. So they do offer a stream of benefits. They talk about professional training, tuition reimbursement, exam reimbursement. Being able to get discount from Walgreens is something that is also a benefit for this role. So definitely check out CareCentric, and this opportunity is open right now. All right, so the next one that I wanted to talk about is this one right here, which is the last one. It's also in healthcare, and the name of the organization is LifePoint Health. LifePoint Health is a health organization as well, so it's healthcare. They're committed to helping people navigate the healthcare system, helping people become better in learning more about their health, helping people become better in utilizing their health insurance, utilizing the different benefits that comes with their health insurance, kind of helping people open their eyes to what is available to them, especially if you have health insurance already. What are some opportunities there you should be leveraging to help you stay healthy? So that's what the organization focuses on. Right now, they're looking for a credentialing support specialist. This is a fully remote role, as you can see on here. With this position, what you're going to be doing really is helping to provide some kind of support around credentialing for providers, making sure like doctors, facilities that are providing different services, that they remain credentialed. So if they are like their credentials, the licensures for them, if they are expiring or coming to an expiration date, this individual will provide those type of support, reminders, in some cases help submit applications, help get the renewal process going, etc. What would you do as a credentialing support specialist? You'll be responsible again for data entering, gathering, primary source verification, right? Verification of licensure, primary methods of researching information, making sure that whenever people take positions that their credentials are actually what they are, validating, confirming, etc. So with this position, they are asking for high school diploma or GED. In addition to that, they are also asking for 1 year of medical staffing credentialing required. So meaning have that experience. Have you worked in credentialing before? This is where they need you to say yes, because that is very important for this role. And this position, the salary range is between $19 and $25 per hour, but definitely continue to explore, especially my nurses, because I know I've gotten feedback in the past where nurses are looking for opportunities to work from home. This is another company to add to your reservoir for researching and potentially landing that your next dream job. This is definitely another website to explore. So those are the opportunities for this video. I hope you find these leads helpful. Give this video a thumbs up. Subscribe to this channel if you've not subscribed already. Till next time, I wish you guys all the very best of luck, and I will catch you in the next video. Take care, guys. Bye-bye.